Getting a diagnosis is hard. It's okay to be sad about it, right? And then it can be actually, a gift in some ways because now you know, and now you can start to do things to prevent the disease from progressing faster than it needs to be.
When you get your first diagnosis, or when you hear first about your diagnosis about ADPKD, that's going to be a very important moment of your life. It could be very scary, it could be very burdensome, so it's important to kind of take a deep breath and then understand what needs to be done.
So a lot of times patients will be like, well, I feel okay. There's nothing happening. I know patients that look a lot like me will be like, I feel good, nothing's wrong. I would just advocate that they actually pay attention to the provider and don't stop there to actually go forward with getting all the necessary tests that they have to prolong their life.
They'll meet with the physician or a nurse practitioner for initial consultation. And after we gather all the data, we're able to formulate a plan that best suits the patient for where their kidney disease stage is at.
What we do is we usually obtain either a CT scan or MRI. We prefer an MRI of the abdomen. It gives us a great picture on the kidneys. We obtain something called total kidney volume, or TKV. And from that, we adjust to your height and your age. And then that helps us understand when it is predicted to have kidney failure, or hopefully never.
PKD patients will have blood tests to evaluate their kidney function and overall health, imaging such as an ultrasound, CAT scan, and MRI to review the function, number of cysts, and size of the kidneys. In collaboration with the comprehensive history and physical, this will help me to build a foundation to develop an individual plan of care for the patients.
So it's important to know where you stand, and don't assume the worst until you are seen by a specialist that knows what polycystic kidney disease is, give you the right diagnosis, and then give you the right risk stratification or prognosis.
The diagnosis is not the end. It's something that you've had that is becoming more relevant in your life as your kidneys begin to become cystic. I think the biggest advice is to continue a positive attitude, maintain a lifestyle that keeps you happy and engaged.
If your diagnosis of PKD is very overwhelming, it's okay. That's a normal reaction that you have now a new diagnosis. So any medical diagnosis, it can be very difficult. Now understand that, yes, it's a diagnosis of chronic kidney disease, it potentially can lead to kidney failure, but again, it's not imminent.
The key steps for a patient newly diagnosed with ADPKD is just to get as much information as possible. So this is a disease that for most people is slowly progressive and lifelong, and we think that the more steps taken early in the disease process, the more able we are to manage the disease to help slow down the pace of the disease.
For anyone that's newly diagnosed with it, just to do your own research, right? Feel some empowerment in it. It's a chronic disease, so it's not immediate. So you have time to kind of sit with it, give yourself grace. There are days where it is overwhelming. And then there's days you don't even think about it. For anyone who's new, just kind of empower yourself through the resources that there are. Start to talk to doctors, kind of figure out who your care team is. The PKD Foundation was a huge source for me when I first was diagnosed, and just seeing what their chapters were, but also seeing what activities, what community engagement stuff you can get involved with. There's a bunch of patient support groups too with PKD. Living with PKD has been also helpful.
Polycystic kidney disease it carries the burden of chronic disease, and you carry that burden as a caregiver differently. As a parent and a caregiver, you carry that differently as well. The truth of the matter is, there's massive amounts of resources available, but it's hard to find that and to know that in the beginning. While it is a chronic disease, it can be a very slowly progressing disease. Once you start to learn about it, it starts to remove some of that high stress from you.
Unfortunately, we don't have a cure yet, so we cannot reverse it and we cannot stop it completely. Our hope is to slow it down. We talk about risk of rapid progression, but even with the risk of rapid progression, we're talking about years of progressing. It's important to kind of take a deep breath, and then have a good support system with you. Identify a caregiver, identify a family member or friend who can help you navigate all these. It's important not to go through that journey alone. Definitely, we're welcoming you at Mayo Clinic and other PKD centers to help you with all these different stages, to cross these difficult bridges. The glass might be half empty, but also it's half full. See that half full, see that there's all these advances available to you. Make sure that you have someone who helps you to get to them.
I had to realize that our lives really have not changed. My advice to anybody that is going to be a partner in this is to realize to just keep going. Keep doing whatever you're doing, okay, along the way. Let the doctors take care of polycystic kidney disease. Life does not change.